I'm Dr. Heather Hirsch, and welcome back to my YouTube channel where we are discussing all things midlife, menopause, perimenopause, and hormone replacement therapy. Today, I want to talk about the side effects from testosterone. Now, if you've never heard my ice cream cone sundae about hormone replacement therapy, I'm going to get into that where I call the ice cream the estrogen, the cone the progesterone, and the testosterone kind of the toppings of that ice cream sundae. But a lot of women are interested in testosterone, trialing testosterone, and wondering, is their testosterone dose right? And are these side effects coming from my use of testosterone? So if you're interested in what these testosterone side effects are and how we can fix them, stick around. If you don't know me, I'm Dr. Heather Hirsch. I'm the founder and CEO of The Collaborative. It is the premier integrative telemedicine platform for all things midlife women's health. More about that at the end. I also completed a 2-year fellowship at Cleveland Clinic back in 2014, and I've dedicated the last 12 years of my career just to prescribing hormone replacement therapy. So if you want to know about testosterone, there is so much that we could cover. One of the questions women come to me with is how do I know when to add testosterone and what are the benefits of testosterone? So why don't we start there for simplicity's sake? In 2019, the guidelines were published that were endorsed by many societies, professional societies like the Menopause Society, the British Menopause Society, the Endocrine Society, which really set up the guiding principles for prescribing testosterone for women. And the principles really were as follows. If you are a postmenopausal woman, yes, I prescribe it for perimenopausal and premenopausal women as well. But if you're a postmenopausal woman who has low levels of testosterone or low serum testosterone in your blood work, that is a level, say, less than 20 or 25, depending on where your lab comes from, and you suffer from hypoactive sexual desire disorder, which is low libido that's frustrating to you, this is where transdermal testosterone at physiologic levels can be useful. That is a mouthful, and I want to break down a lot of that. Now, first, transdermal means that you do want to apply testosterone as a cream or a gel when possible. Now, injections are an option. However, I will say in prescribing testosterone for over a decade, injections can be very hard to titrate to get to the right amount. If you take too much testosterone, you're going to have long-lasting side effects that are really, really hard to undo because it takes a long time for those testosterone levels to come down. So if you can get benefits from a daily application onto your skin, this is going to be the best for you. And the second part of that guideline was physiologic levels. So women really should be aiming to keep their testosterone levels on the higher end of normal spectrum for them. Women typically do not walk around with testosterone levels any point in their lives over really 60, 70 or so. And when those levels become 100s, in the 200s, in the 300s, which is what I see with pellet injections. In fact, I have a whole video on why not to use pellets here that I highly recommend you watch. If your levels are way too high, you are going to have very serious and long-lasting side effects. So to summarize, guidelines say that the most appropriate use for postmenopausal women to use transdermal physiologic levels of testosterone is hypoactive sexual desire disorder. But many women in my clinic experience other benefits from the use of testosterone. They often find that it helps with their mood. They often find that it can clear that remaining brain fog. Sometimes they find it helps with their joint aches and pains. I have even a patient who said it helped her sleep. And so there is a lot we don't know about what we don't know when it comes to the use of physiologic levels of testosterone in women. So this is particularly important. Now, thinking about my ice cream cone sundae when it comes to hormone therapy. If you're new to my channel, hi, I have so many videos. I definitely want you to binge. But when it comes to hormone replacement therapy, typically testosterone is the last part of the puzzle that I will add. And the reason for this is that I tend to think of estrogen as the main ingredient when it comes to hormone replacement therapy. A lot of the symptoms that women suffer from, such as hot flashes, night sweats, vaginal dryness, pain with intercourse, dry skin, itchy ears, change in mood, inability to sleep, these all come from low estrogen. And estrogen is the main hormone that is dropping precipitously through that perimenopause to menopause transition. And this for many women, but all women are very, very different. Estrogen typically is the mainstay of hormone replacement therapy. Then if you have a uterus and you're postmenopausal, you do need to take progesterone to protect your uterus. In fact, I just did a great video all about progesterone here. And so then the next step after you get your estrogen is to find the right matching progesterone. So if estrogen is, or hormone therapy rather, is an ice cream cone sundae, the sprinkles on top is like that testosterone. You might feel like that regimen is pretty good, but there's just one little piece missing. And for some women, that can be the testosterone. See, hormone replacement therapy is often more art than science, although as the clinician, it is my job, my number one job, to ensure your safety. And this means that we're using physiological levels of testosterone that we can easily control, i.e. we can either bring down or bring up using a transdermal delivery system, and ensuring that you don't get any unnecessary side effects. So we're already deep into this video and you're thinking, I came here for the side effects from testosterone, so let's get into those side effects. The first thing I will say, in all of my decade-long plus experience of using testosterone for women, not just in menopause, but also in perimenopause, because perimenopause essentially is menopause when a woman is still having periods or still ovulating. Side effects from testosterone are dose dependent. That really means that the higher the dose goes, the more likely it is that you'll have side effects. And so if you are using, again, a delivery system where you can easily control how much testosterone you're getting on a daily basis, you do not have to worry terribly about side effects because they will not come on fast. It's when women get pellets and these medications injected into their system that you cannot easily control. And levels are known to go really high that you can get side effects from testosterone. So what are they? Well, typically women will see acne. Now, testosterone is responsible for a lot of cystic or hormonally mediated acne. So this is why young boys, when they're getting a surge of testosterone in puberty, and even girls as well, will develop a lot of acne in their teenage years. That testosterone is really increasing. It also explains why, if you've ever been put on birth control pills actually are androgen blockers. They block testosterone. And that's one reason why skin really clears up when placed on birth control pills. It stops the hormonally mediated acne, which really can be called testosterone giving you acne. So acne is one of the first things that you can notice. The second thing that you can notice is hair loss or hair thinning. And typically, if it's androgen driven, which is another word for testosterone driven, it's in this male pattern type of balding. So you might see hair start to kind of thin around the crown or maybe even in that back of the head there. And this can be insanely disturbing for women because you definitely do not want to start hormone therapy in the hopes of losing your hair. In fact, you may be starting hormone therapy because of hair loss. Now, you should know that that is a side effect of testosterone, and if hair shedding or hair loss is something that's really bothering you when considering or starting hormone therapy, I, as your clinician, again, I'm a doctor but not yours, I tend to really wait to add testosterone, and we may not even do it just because we don't want to tip the hair in the wrong direction. Too much testosterone can also sometimes cause chin hairs or hairs on your upper lip or even hairs on your chest or hair where you don't want it. Yes, you are going to maybe get hair where you're also putting the gel. So if you're using androgel or if you're using Testim gel, which is what I typically do and recommend, you may get a little teeny tiny patch of hair, and that's why we recommend doing it on your legs so you can just shave it right off. But you could, if those serum levels are too high, get hair in unwanted places. Now, the reason I really don't recommend pellets is because I have been doing hormone replacement therapy for the last 12 years. And of all of the side effects that I have seen from the use of testosterone and the use of hormone therapy in general, it has been from the unregulated use of supratherapeutic, i.e. way too high levels of testosterone from pellets. I will see women have deepening of their voice. In fact, I had an opera singer come to me whose voice changed because of long-term use of pellets. You can also get enlargement in your clitoris. Now, if you've never really studied the clitoris, which you may not have, but I do, and it is essentially a small penis, and it can grow in size to where it becomes very obvious if you're looking down there with a mirror. That's called clitoromegaly. That is the medical term for that. And these things can be irreversible, because if you do think about what's happening when you're transitioning from, let's say, if you were born and you're given the gender of female, but you identify as male, you're going to take a lot of testosterone to irreversibly cause physiologic changes, such as deepening of your voice, facial hair, and etc. So you do not want testosterone levels that are too high. And if you are using transdermal amounts of testosterone, this is extremely unlikely to happen, but it is very likely to happen if you're using a pellet, something that's going to be inserted into you that you cannot change for 3 months. To add to that, testosterone levels are actually pretty stubborn, and it takes a long time for them to come down. For example, I have patients who have been on pellets, and it will take 3 to 6, even sometimes up to 9 or 12 months, a full calendar year, for those testosterone levels to come down. When this happens, we can also see derangements in liver and lipids. So dyslipidemia, like really, really high lipids or really high triglycerides, can happen when your testosterone is unregulated, and you can have liver abnormalities. So you can have a abnormal AST or ALT is what your doctor might look for. Now, if you are a woman and you have been taking pellets and you came to this video because you're having side effects, a couple of things that you need to know. Number one, there is absolutely help, and support out there. I want you to watch this video on how you can transition off your pellet hormone therapy. I've been doing this for years, and this industry really rose out of the fact that there were not enough clinicians who could help prescribe FDA-approved hormone replacement therapy. Now, testosterone is actually not FDA-approved, but at the end of this video, I'm going to tell you how I prescribe it. And now that we have more doctors who know how to do this, we really don't need to use compounded or unregulated, unstudied medications in your body. They are not certainly better for you, and they are not beneficial in the long term. So you can get off pellets. Because the last thing I want to say about side effects from these super therapeutic levels of testosterone is we do not know their impacts on breaking down bones, which can happen if the testosterone is too high. Is probably breaking down bone. It could be breaking down muscle. It could cause you to be really, really hungry. You could get an android pattern. You can actually gain weight if your testosterone levels are way too high. And by way too high, I mean over that 150 into the 200s and upwards. Those levels are too high. These are physiologic low levels for men. So if this is you, there is so much hope and support. So let's get into how I prescribe testosterone in my clinic. Again, I'm a doctor, but not your doctor, and all doctors have different education on this. If you are a clinician, you definitely want to get into my How to Prescribe and Manage HRT course where we talk about this. Now, when we prescribe testosterone for women, we do prescribe either androgel or testim tubes, and these are packets or tubes of testosterone. Now, these packets or tubes are meant to last a man 1 day. He, if he has low testosterone as replacing testosterone, would use one of those packets or tubes a day. Now, because women make about 1/10 of the dose of testosterone that men do, you're going to use one pea-sized amount of either that packet of androgel or that tube of testim gel and make those packets or tubes last 10 days. That's right. So that's how we do it for patients in our clinic, and we give you a lot more information and support and check your levels before and after to ensure that you are not having levels that go too high, and we also talk with you directly to make sure that you are not experiencing any side effects, because you do not have to. All right, I hope this video was informative. We went over a lot. We talked about my ice cream cone theory of hormone replacement therapy. We talked about why you could start hormone therapy, the guidelines around hormone therapy, what it may be beneficial on, and making sure that for most women, you do this after you've got your estrogen and progesterone doses correct. We talked about the best way to do this, which is a transdermal application of using physiologic levels of testosterone. We also went over the side effects from testosterone. Now, the best part about having a gel or a cream that you place every day is if your levels get too high, you can easily dilute that by using it every other day or every 3 days. In fact, I have some patients who use their testosterone twice a week, and that keeps them at a nice, low, steady level where they feel some benefits in terms of libido or reduction in brain fog or improvement in mood or a better muscle mass, but they don't feel like they're getting side effects. If you want to work with me or my team, there are so many ways to do so. Everything's going to be in the description below. If you want to check out The Collaborative, this is the premier telemedicine platform. Go to jointhecollaborative.com. If you're a clinician and you want to get some of my courses, you want to actually be able to walk and consult your patients through all of this information, go to the Heather Hirsch Academy at heatherhirschacademy.com. I also have tons of videos here on my YouTube channel for you to binge. And I also have a podcast, Health by Heather Hirsch. Please like and consider subscribing. In fact, don't consider it. Do it right now. Do it right now. That's telling the YouTube algorithm that this is the premier place for all evidence-based information when it comes to midlife and menopause and hormone replacement therapy. Or pick up my book, Unlock Your Menopause Type. There is so much in there. I cover how you can really manage the menopause transition with over-the-counter supplements, non-hormonal therapy, and hormone replacement therapy. All right, guys, till next week. Bye, everyone.